The crushing mental health costs of COVID-19 on healthcare care workers. This article deals with how health personnel in New York City suffered severely from the consequences and the aftermath of the COVID-19 pandemic. Last year, health personnel resorted to elements such as creating their own suites of security protection elements with garbage bags, so much so that the DNA tests could not be taken even when health personnel had symptoms. This article also talks about how the military force came in to help health personnel, and they realized that this situation is like the closest thing they had seen in a civilian population. And the emotional burden of the nursing staff is also reflected, as they did not rest. They did not take their breaks but stayed with their patients, holding hands to be able to give them moral support under their battle. They also served as assistants in the calls, phone calls, or video calls that patients had with their families, since the families could not be close at the same day. When the adrenaline of the nursing staff and medical staff stopped running through their blood, the aftermath of this pandemic was seen causing suicides, even in a doctor in the emergency room, and the medical technical. Feelings like exhaustion, like pain, like overwhelming, the insomnia and anxiety are what also led to depression and exhaustion of health personnel, and yet the mental process that nurses and medical personnel in New York was undergoing would not be immediately slowed. They were filled with hopelessness when they realized that the peak of the pandemic did not go down because people were not paying attention, that they were not using the masks, I have not taken on social distancing, and this even filled him with that anger and perhaps that frustration, knowing that they could not save lives. They also reported situations where health personnel had to make difficult decisions for patients due to the lack of ventilators and medical resources in the hospital. However, we can see that at the end of this pandemic, strategies were implemented to keep the nursing staff and medical personnel safe, not only in their bodies, but they also realized that even in his pandemic, when the body was cared for, the mind was unprotected. This was very unprotected, the mind was vulnerable, and that the one that perceived the most the consequence of the pandemic by COVID-19. Programs were implemented to help in the mental health of health workers. Even the army showed and how they treated the post-traumatic stress disorder and helped the health personnel to implement these techniques and strategies to able to cope with this mental situation suffered by those who worked in health. The Dr. Roy Perlis ended with the following sentence: I think part of the battle is the recognize that healthcare workers can feel less like to seeking care, even if we are more informed about mental health. We are not immune to worrying about stigma and what our college will think of us. This article is very important since it shows how health personnel they were affected not only physically but also mentally. Mental health was at a risk and was the most injured in this pandemic that was happening in the world in 2020, and it is important that the strategy they created to protect the mental health of workers in New York City can be implemented in the rest of the cities where the pandemic hit held personal heart. I recommend your reading. Thank you.